In 2018, government developed differential antiretroviral therapy service delivery models guidelines to streamline HIV service delivery. Under this model, service delivery is differentiated based on whether people living with HIV are stable or unstable clients. With this in mind, Makerere University School of Public Health undertook an assessment to find out whether the integration of family planning with HIV service provision has been effective. The assessment found that clients agreed with the integration of family planning into the HIV care clinics as they found this convenient and less time-consuming.
That would be convenient and less time-consuming. If we could get all our services in one place, that would be convenient. That would be less time-consuming. And that was a good perception.
This integration also saved the clients, especially women, from long referrals where they had to wait in long queues to get treatment and other services.
One could refer outside, the 14 would refer internally, like intra-facility referral from one point to another point, from the art clinic go to the maternal and child health clinic.
However, a number of barriers to a successful integration were also discovered during the assessment. Among these are staff shortages, supply stockouts, shortage of space, and increased workload for the available service providers.
Another challenge to integration is commodities are not there. If they would be providing us with a constant supply of these short-term commodities and there are no stockouts, then our service delivery would be perfect.
The assessment recommends that the Ministry of Health, together with implementing partners, revise the guidelines to strengthen the integration of family planning measures with HIV prevention.
FP-HIV implementation guidelines. There's one thing having it in the policy and another thing giving you the guidelines on how to implement.
The ministry was also asked to review the staffing of health centers to ensure a smooth integration.
And cross-train where needed, because you have one person providing FP and family planning at one point, they may not have training in the other service. So cross-train where needed. Also, you could also recruit new staff if needed.
But there was a call for integration, there was a call for distribution of the different supplies, as a response and management of during COVID time. So I'm just checking if we made a reference to that information.
Consider integrating family planning into DSD model. How are we going to ensure that we don't leave the community in this dilemma of thinking any commodity can actually be accessed from the...
At this moment, there's actually a discovery process with Ministry of Health, ACP, and stakeholders to see how family planning can be integrated at the pharmacy. Hopefully soon we can present the finding and the suggested methodology to the stakeholders, but for their input.